Hi, this is Dr. P. Mageshwari, Associate Professor, Department of Pharmacy Practice, School of Pharmaceutical Sciences, Vistas. So, we are discussing about urinary tract infection. So, coming to the background, urinary tract infection of urinary tract is the very common reason to seek health services. So, the common in young females and uncommon in males under the age 50. So, common causative organisms E. coli, gram-negative enteral bacteria causes the most community occurred infections. Then Staphylococcus saprophyticus, gram-positive organism causes the 10 to 15% of the cases, and catheter-associated urinary tract infections caused by gram-negative bacteria, Proteus, Klebsiella, Serratia, and Pseudomonas. So, coming to the pathophysiology. So, pathogens which have colonized urethra, vagina or perineal area enters the urinary tract by ascending mucous membranes of perineal area into the lower urinary tract, and bacteria can ascend from the bladder to infect the kidneys. So, it will be affecting the upper urinary tract and lower urinary tract also. So, here we can see them female and male urinary tract. So, coming to the urinary tract infection. So, upper urinary tract infections, that is a flow nephritis, that is a inflammation of the kidney, and lower urinary tract infection, that is a cystitis, that is inflammation of the urinary bladder, and urethritis, that is inflammation of the urethra, and prostatitis, that is inflammation of the prostate gland. And coming to the symptoms of urinary tract infection, dysuria, that is painful urination, and increased frequency of urination, and hematuria, presence of blood in the urine, fever, nausea, vomiting, and flow nephritis. So, coming to the culture in urinary tract infection. So, most common pathogen for cystitis, prostatitis, and flow nephritis, that is E. coli, Staphylococcus saprophyticus, Proteus mirabilis, Klebsiella, Enterococcus. So, most common pathogen for urethritis, Chlamydia trachomatis and Neisseria gonorrhoeae. And coming to the lower urinary tract infection, that is cystitis, that is uncomplicated cystitis. So, in healthy women with no signs of systemic disease. Then complicated cystitis. So, in men or women with comorbid medical problems and recurrent cystitis. So, these are the three types of the cystitis. So, here we can see the picture, the cystitis, the urethra is fully inflamed. So, inflammation in the urethra. Then uncomplicated or simple cystitis, definition, healthy adult women over the age of 12, non-pregnant, no fever, nausea, vomiting and flank pain. Then coming to the treatment, trimethoprim and sulfamethoxazole for 3 days. So, may use them fluoroquinolones, ciprofloxacin or levofloxacin. And risk factors, sexual intercourse. Then complicated cystitis. So, females with comorbid medical conditions, all male patients, catheter users and hospitalization. So, those patients are having hospitalized. So, mostly they can get them complicated cystitis. So, treatment like fluoroquinolones or other broad spectrum antibiotic, and 7 to 14 days of treatment depending on severity, and the patient may treat even longer, 2 to 4 weeks in males with UTI. Then recurrent cystitis, want to make sure urine culture and sensitivity obtained, and may consider the urological workup to evaluate for them anatomical abnormality and treat for 7 to 14 days. Then coming to the flow nephritis, that is infection of the kidneys associated with constitutional symptoms like fever, nausea, vomiting and headache. So, coming to the treatment, 2 weeks of trimethoprim and sulfamethoxazole or fluoroquinolone. Then hospitalization and IV antibiotics if patient unable to take peroral. So, here we can see the picture, a kidney affected with flow nephritis, that is inflammation of the kidney. We can see the picture. Then prostatitis, symptoms like pain in the perineum, lower abdomen, testicles, penis and with ejaculation, bladder irritation, bladder outlet obstruction, and sometimes blood in the semen. So typical clinical history: fever, chills, dysuria, malaise, myalgia, pelvic and perineal pain, cloudy urine. And coming to the treatment, trimethoprim and sulfamethoxazole, fluoroquinolone or other broad spectrum antibiotics, and 4 to 6 weeks of treatment. And risk factors: sexual abstinence and dehydration. Then here we can see the picture: normal prostate and prostatitis, that is the inflammation of the prostate gland. And coming to the urethritis, chlamydia trachomatis, it's the causative organism for urethritis. So it's frequently asymptomatic in females but can be present with dysuria, discharge or pelvic inflammatory disease. So chlamydia screening is now recommended for all females less than 25 years. So coming to the treatment, azithromycin 1 gram per oral and doxycycline 100 mg per oral 2 times per day for 7 days. And Neisseria gonorrhoeae may present with dysuria discharge and send the urine culture. Pelvic exam, send the discharge samples for gram stain culture for diagnosis. Coming to the treatment, ceftriaxone 125 mg intramuscular, ciprofloxacin 500 mg per oral and levofloxacin 250 mg per oral and ofloxacin 400 mg per oral and spectinomycin 2 gram intramuscular. So here we can see this picture. This is the female and male urinary tract. Thank you. Thanks for watching.